In this section, we're going to discuss specificity of data. Now, what do we mean by specificity of data? Well, we're really talking about detail and granularity of our data that represents the true clinical picture of not only how healthcare providers are utilizing your company's products, but more critically, the result of that increase in the detail and granularity will enable us to obtain the deepest and most accurate insight into how your products are really working and how effective they really are for our patients. So first of all, let's take a step back, and if we look at medical conditions overall, we can divide them really into three categories: structural, localized, metabolic, and systemic. Systemic would be examples like hypertension. An example of metabolic would be diabetes, although diabetes is really a bit of a hybrid between both of those. And if we look at the final division over here, structural and localized conditions, these are, again, as indicated, they're going to be more structural and more localized. For the sake of our example here, we're going to talk about structural or localized conditions because they're easier for us to visualize. But the exact same principles that we're going to show here are applicable to both metabolic and systemic conditions as well. So again, remember, what we're going to talk about is going to be for structural and localized conditions, just for the sake of the example and to give us easier visualization. But these same things hold true for metabolic and systemic conditions as well. So in our example here, let's first of all talk about hallux abductovalgus, or bunion deformity. Here we have our ICD codes. And what is hallux abductovalgus, or a bunion? Well, it's when we have deviation at the first metatarsal joint. And as we can see, the first metatarsal here, if we go straight up, is medially deviated or moving toward the midline. And then if we look, the great toe is actually leaned towards the neighbors, the lesser toes. All relevant if we move to the second metatarsal, where we see it's nice and straight. So we can see there's a deformity of the first metatarsal phalangeal joint. Again, medial deviation to the first metatarsal, lateral deviation to the hallux, and we can even see what appears to be almost a bump to the outside of the foot. And now it really isn't a bump or a bony overgrowth of any kind. Really, it's purely just deviation from that great toe, the hallux, literally moving to the side and pressing the head of the first metatarsal more toward the midline, where we see what could be mistaken as a deformity. So let's take a look at this, and we see that we have deeper divisions of that. So now let's evaluate the detail or the granularity of this particular example, hallux abductovalgus bunion deformity. If we pull up this diagram over here, on the left, we can see in slide A, we've got overall just a mild bunion deformity. And we can see in relationship to the second metatarsal, we have some medial deviation to the first metatarsal and some lateral deviation to the big toe, but we see that it's fairly mild. There's still a bump to the side, and this can be painful for our patients in a shoe, but it is considered a mild condition. The next example we'll pull up here in the middle is going to be an example of hallux abductovalgus, however, with a very arthritic great toe joint. And if we do a little comparison, if we look at the second metatarsal phalangeal joint directly next to that, we can see there's almost a joint space in the center. And the reality is there's not a joint space there. That's the area where the cartilage from the second metatarsal head is in proximity, or where it's actually touching the cartilage at the base of the second digit. There are actually two of the cartilaginous surfaces from both of the two bones that are in proximity that are actually touching. However, cartilage is not visible on X-ray. That's why it appears as an open space, which is a good thing. We want to see that because that indicates that this is a healthy joint with normal cartilage. If we look at the great toe joint, where the arrow is pointing in the middle, we can see we don't see any open space there. We even see some fuzziness almost, or what we call sclerosis, to the area that's next to the second metatarsal phalangeal joint. That's indicating that there's not only arthritis, but there's some additional new bony growth around that area. All of these things are indicative of an arthritic great toe joint. And now we can look at further detail yet. On the example on the right side, we can see this is a much more severe case of hallux abductovalgus. We can see there's much greater medial deviation to the first metatarsal, much greater lateral deviation to the hallux. We can see the bump appears much more exaggerated. If you look, it appears that the hallux is almost underlapping or maybe overlapping, but it's really crowding that second toe in a much greater fashion. So this would be considered a severe hallux abductovalgus deformity. Granularity is key. All of these have the exact same diagnosis of hallux abductovalgus, and yet you don't need to be a physician or any type of a clinician, any type of healthcare practitioner to see that there's absolutely difference in these three examples, and yet they're all hallux abductovalgus or bunion deformity. So to capture real insight with our data, we need to have some mechanism to capture these various details, because the key to this, not only do we want to know what we're treating, but the critical piece to that is how effective your particular drug, medication, or medical device is for hallux abductovalgus. Taking it further, whatever the medical condition might be. Let's look at the treatments. If we go back to the example on the left side, example A for the mild bunion deformity, if your company manufactures an NSAID, a non-steroidal anti-inflammatory medication, that would be an excellent choice for that particular. A short course of it would probably give this patient very nice relief. So your product may score extremely high on patient satisfaction for that level or that detail of hallux abductovalgus. When we look at the arthritic joint in the center, if we tried a course of anti-inflammatory medication for that, it might give us some degree of relief, but the minute we stopped using the medication, that pain would come back because the severe arthritis is still there. That severe degeneration of the joint is still present. So a short course of NSAIDs, non-steroidal anti-inflammatory medication, would provide some relief, but the minute the patient stopped using it, they would probably have no additional relief after that, and the pain would quickly return. If we look at the example on the far right, the severe hallux abductovalgus deformity, the NSAID might provide very minimal relief in this case, because that case on the right side, the severe case, is much more of a surgical condition until we actually do what's called an osteotomy, where we actually straighten the first metatarsal and then release the great toe and straighten the great toe so it appears in much more of a straight line where that joint is supposed to function. Until we achieve that, this patient's always going to have pain. So no matter how much medication we give them, that's not going to help that. Now, if your product is a medical device, such as a joint implant, there's a number of manufacturers out there that manufacture joint implants for that first metatarsal phalangeal joint. That would be an excellent choice for the middle case of hallux abductovalgus here. The center diagram, that arthritic toe joint, that's the perfect indication for that. So that's an example of how critical it is to determine the detail that's involved clinically so that we can get an appropriate assessment of how well our drug or medical device is performing. An arthritic toe joint, an excellent choice would be a joint replacement. Or if the physician, surgeon, tries a joint implant on the example of severe hallux abductovalgus on the right side, that's not going to get us a good result. Most of our joint implants are made out of either a celastic, silicone type material. Some are made out of titanium, or even others today are made out of nitinol, a newer material. That type of implant is going to fail with this severe type of hallux abductovalgus because we didn't do anything to correct or straighten that joint deformity. So unless we did a tremendous amount of work to straighten the bunion deformity there and to get better alignment, that irregular alignment is going to cause tremendous rapid wear of any joint implant that we try to put in. So the joint implant would actually not be an excellent choice and would probably not have good results for our patient if the physician used it on the severe case of hallux abductovalgus. So here we're starting to really appreciate how critical it is to be able to understand the detail or the granularity of our data, because again, just looking at hallux abductovalgus, all three of these fall under that diagnosis, and yet we can see how different they are clinically, and we can understand and appreciate now that radically affects the treatment that's going to work most appropriately. So your drug or medical device may be an excellent choice for one where it's, as we say, clinically indicated. Then we're going to have extremely good results for the patient. The patient will be very pleased, an excellent clinical result. And we probably won't achieve good, successful results for the patient. Is that a problem with your drug or your medical device, or was it just used at a time when it shouldn't have been used, or when we know ahead of time it's not going to work? So if your current data source, and this is the real take-home message, if your current data source just pulls data based on a word search, which is what most do, then you'll have no way to distinguish which of those degrees of hallux abductovalgus you're getting in your data. So the results that you get for your product are going to be tremendously inaccurate. And I will repeat, the data that you get, unless it has this level of granularity, your results will be extremely inaccurate, because we don't know which one of those your product was used on. Was it used where it was truly indicated or not? And if it was used where it wasn't truly indicated, then we know the result is going to be far worse. And this will tremendously skew the details on the success or the effectiveness of your product. Let's take a look at one more quick example. This was a bony example, but let's take a look at one more. Let's take a look at a second example, a skin ulceration of the foot or ankle. Now, a skin ulceration is basically an open wound. This is something we see frequently in our diabetic patients. So there's a tremendous amount of emphasis today in our market on wound care, and we're basically talking wound care for these skin ulcerations. And here we have the ICD codes. In our first example here on the left, this is an example of a wound ulceration over the ankle area. And if we see, there's a deep area of what we call beefy red hypergranulation tissue. A second example of an ulceration, and here we see that area of almost black appearing tissue. This is what we call black necrotic eschar tissue. And in our third example here, on the right side, we can see kind of a yellowish appearing tissue, and we refer to this clinically as a type of yellow stringy necrotic tissue. We can appreciate now the difference in these, the beefy red hypergranulation tissue on the left, the area of necrotic eschar in the center, and the area of the yellow stringy necrotic tissue on the right side. These are all clearly different conditions. However, they're all considered ulceration of the foot or ankle. If your current data source is pulling you data on ulceration of foot or ankle, you have no idea which one of these you just got. This is why detail of data, that detailed granularity, is so critical. With the Starwriter system, we capture this accurately for you every time, so there's never a question which one of these you get. What's the critical part of that? Well, if your wound care product is designed for either the beefy red hypergranulation tissue on the left, the area of necrotic eschar in the center, or the area of the stringy yellow necrotic tissue on the right side, if your product is designed for one of those, it's not going to work too effectively on the other two. If it works on the beefy red granulation tissue, it probably won't work too successfully on the eschar or the stringy necrotic tissue. If your product's designed for helping resolve that area of the blackened eschar, that's going to be another type of a wound product. And a third type of wound product would be required for the yellow stringy necrotic tissue. The same wound care product would not work equally for each one of those different clinical scenarios that we have. This is the data that's critical. This detail, this granularity is critical for us to be able to obtain The Starwriter system does this for you. Almost all of our competitors cannot separate this level of granularity for you. Do you really know how well your product is working? Are you really getting a good picture with the data you're getting on how effective your product is? Or are you getting other things thrown in where we know your product isn't going to work as well? And is that overall lowering the effectiveness of your product? Because in your data set, you're getting things where it was completely not indicated. This is what's critical about being able to pull that granularity so we can get the greatest and deepest insight and the most accurate insight into the effectiveness of your products clinically for our patients.